had to swap it around. So good morning. It's still morning, it looks like. I'm Frank Cornelia. I'm the director, deputy director and chief strategy officer for the Colorado Behavioral Healthcare Council. It's good to be with you all today. I really appreciated the Mental Health Center of Denver's efforts to reach out to us and to put together this advocacy series. This is the last one in the advocacy series. As a reminder, in January, we'll be doing sort of an epilogue on community organizing. And so we look forward to having you all join us in January for that, and hopefully having some special speakers with some expertise in that area. But today we're going to talk about sort of the 301 is, what happens when you're in the room and sort of that direct linkage to your legislators and how to advocate once you're in the room. So I'm pleased to be joined today by Katie Mason of the Mental Health Center of Denver, and then my colleague at CBHC, Moses Gurr. So for the meeting today, we're going to, you're in the room, now what? We want to talk about how to research your legislators and policymakers. We want to talk about how to craft your pitch, and Katie's going to walk through an example there. We want to talk about how to position your organization and Mental Health Center of Denver as a resource and a partner to your legislator, your representatives. We want to talk a little bit about how to follow up and maintain the connection. And so that's a little bit about where we're going today. So before the hearing, we want to talk a little bit about what kind of information you want to look up prior to your meeting. Does that change depending on the nature of the meeting? And I think Moses is going to talk a little bit about how to do your homework.
Sure, I'm happy to kick it off. Thanks, Frank. And really, we wanted to make sure that we made some time for us all to think about what kind of information do we look up prior to actually sitting in the room with the policymaker, and does it change depending on whether we're getting ready for a hearing or a one-on-one meeting or anything like that. And again, as always, feel free to jump in and ask questions. But I know that part of what we do at CBHC when we try to do our homework is really dive into who these elected officials are. Thinking about what are some of their key issues or interests, where have they placed their votes or their sponsorship in the past? Have they served on any relevant boards, for example, or in any other sort of capacity? And all of this different information can help us get a good sense of who they are and what they care about. So that way we can come in very well informed on what do we need to emphasize. Katie, I'd love to hear a little bit about your process as well as you go through getting ready to advocate.
Absolutely. I think some other things that come to mind about legislators or any policymaker for that matter is what does their professional job look like? And maybe they have a mental health background or have really worked in housing or different areas that really impact the people that we serve, because those individuals have a really intimate knowledge of those topics that can really help bring them along into your support of a particular issue or a piece of legislation.
And I would just say too, in terms of career choice, I mean, many are professionals in other areas, and some of them have had extensive experience in local government too. They've either served as a county commissioner or a city council member, and so those type of individuals oftentimes have a record of their interest areas and votes as well. So.
Yeah, that's a really good point. And even if they haven't been in a public office before, sometimes getting a sense of their previous career is a really good way to see where they've landed before. If they do have any sort of public career, getting a sense of what were some of their big projects, what do they seem to really care about or bring up in presentations or addresses, all of those different things can really help you get a sense of where they'll activate as well. And all of that is very helpful as you craft your pitch.
Yeah, on this slide, this next slide is really just a placeholder to talk about, where to gather some of this information. And so, Moses and Katie and I were talking about some of the links that we use on the CBHC website, the cbhc.org, right there on the slide. We've got 3 links that we, prompt our members to go to often. So this is, there's just some references there on how to decide where to look for information, how to get good information, and what's the best way to know where a legislator stands on some of the issues prior to the presentation. So,
and Moses and I went through the leg.colorado.gov site during our last presentation. So hopefully for those of you that didn't have a chance, you can watch the recording of that session. But that's a great way to understand what's happening at the Colorado legislature, as well as justfacts.votesmart.org. That helps you to locate some of those other politicians that fall outside the legislature. So maybe your federal Congress people or others that might be at those higher levels of government that you can have access to and contact them, because not all policymaking happens at the state level. So you can really dig into things a little bit more with that.
Yeah, great points. And all of these are actually listed on our website. So we put the cbhc.org link over there. We showed it last time. But you can go to our website, Legislative and Community Action page, and find links to these as well. So if you ever forget what one of them is called, feel free to use us as a resource. The other thing I would say is don't be afraid to Google. I mean, it can feel a little strange sometimes when you're getting ready for a meeting to think that, oh, I'm going to try and find out as much information about this person, but they expect it. As public officials, they know that their information, their records, their voting, it's all out there, as well as they may have had media about them or news articles. All of this information can really help you see where they have been activated before and what you might really want to emphasize as you craft your message.
the one thing I mean, in terms of their public information, a lot of them have social media, and so usually it's very rare if you do not have a legislator that has a Facebook page or a Twitter account, and so those are 2 of the primary ways to sort of track their activity on social media. Whether they're tweeting about current events as they're sitting in meetings, sometimes even. And oftentimes we'll post on Facebook, some of the issues that are near and dear to their heart and how they're planning to act or vote.
And I think also in our first presentation, we talked about the access to newsletters that sometimes your legislators or council people might put out through email listservs. So that's another opportunity to see what's of interest to your policymakers.
All right. So tips for engaging policymakers here. We just want to talk a little bit about, really how to get their attention, and then how to speak. This is the how to behave slide. So Moses and Katie, if you have any, if you want to walk us through this.
I can kick us off, and there's some really practical tips on here, like things that you might not think about. For example, it is expected that you address legislators by their title, for example, representative or senator. But beyond that, a lot of this really is sort of just common sense about how do you tell a story and deliver a message in a way that's really compelling. So be prepared. Know exactly what you want to get across. Be concise, be respectful of time. Don't be late, don't go over. Share your personal examples and tie that into data and maps and images, and be engaging both on the sort of factual and the emotional side. And of course, leave something behind to be remembered by. All of these tips, it really is sort of a habit, and it's a practice. You get into a good routine of just how do I prepare for meetings? what do I want to make sure I touch on, and how do I make an impression in a way that's very lasting? And Frank and Katie, with your sort of advocacy and lobbying experience, I'd love to hear if you have any examples or tips on how to get good at that habit and that practice.
I think just going into it with the idea in mind that you want to be really respectful. These are individuals that are kind of held to a higher level. And I really prefer to refer to them in addition to their title as sir or ma'am, just to really like show that you respect them in their position, because that will help them in listening to you and wanting to hear you. Plus, it always puts off an air of professionalism that I think legislators really appreciate. And when they're hearing, especially when they're on the floor and lobbyists are calling them off the floor, to be very concise and respectful, and as much as you can cover respectfully will really get your point across to them. And make them willing to listen, because there are some times where they might be a little bit distracted, or maybe they already know about what you're trying to encourage them to legislate on. So they may have their mind made up, but just, going into it and utilizing your professionalism and respect is really important.
Yep, I would agree with that 100%. And to treat them like human beings. I mean, I think that's the other thing, is that they've, achieved this position, and you need to give them the respect due to their office. But you also, keep in mind that they're human beings. They are stressed. They're, facing a lot of different issues. They have to make frequent decisions that causes some fatigue. And so just to treat them as human beings as well. And the one tip that we don't have on the slide, but I always think it, sort of catches people, is to not engage in politics with a politician when you're lobbying an issue. Politics is the process of getting to the seat. Policy is what they're engaged in when they're working at the Capitol. And so to stay away from politically charged issues, to stay away from some of the party politics, when you're lobbying an issue, it is important to stick to the policy recommendation that you're trying to advance.
Which can be challenging sometimes.
Yes, it can. Okay, next one here, we talked a little bit about some of this, crafting your pitch and some tips. I think Katie, we're turning this one over to you to talk a little bit about what a pitch looks and sounds like.
Absolutely. So we kind of discussed having me kind of go through a pitch, and wanted it to be pretty simple. I thought it might be helpful for it to be something that's relevant to my position as an early childhood mental health consultant at the Mental Health Center of Denver. So I took that example and built off of a bill that was heard during this past session that was specific to early childhood mental health. So hopefully this will give you an idea of something that you might craft as a mental health professional to support or oppose something that is a piece of legislation that's moving forward in the legislature. So this will be kind of a one-sided example of the pitch that I would give to a senator or representative that kind of ties into my work as well as their interest potentially in that piece of legislation and that topic. And for this example, I'm going to be speaking to Representative Singer. He is a social worker by trade and is also, he was the chair of the Public Healthcare and Human Services Committee. So this would fall into his committee, as this was the committee where the particular bill I'm utilizing was being introduced. And he's also interested in mental health issues. So it kind of has that personal and personalized approach, because that is kind of in his, I like to call them like pet projects. So those are his policy issues that he's really interested in. So, hi, Representative Singer. My name is Katie Mason, and I am one of your constituents. I live in your district, and if you have a minute today, I really wanted to talk to you about House Bill 1006, and that is looking at early childhood mental health consultation. I am an early childhood mental health consultant with the Mental Health Center of Denver, and I want to encourage you to vote in support of this bill, because I think that it would be really great for children and families within the state of Colorado. As an early childhood mental health consultant, I help support early childhood professionals, which includes like teacher and aides and staff that focus on those issues, as well as children and their families. And I help them build social and emotional skills so that they're able to be successful in their child care center, as well as successful in their future lives, because they have those skills. Some great things about mental health consultation: it helps reduce burnout for teachers. It helps to identify children who might need additional developmental screening and support, and it helps children learn those social and emotional skills. Something that's also really interesting that is helpful with mental health consultation is that it helps to decrease suspensions and expulsions of preschoolers. I know that you have 2 children who kind of fit into the early childhood category, and I'm wondering if you can even imagine your kids being expelled from preschool. It's pretty drastic action. So it's my job to help make sure that those children aren't being suspended and expelled, and that they learn the skills so that they're able to successfully manage their emotions and are able to work within sort of the system that they're expected to work in. Right now, there are 34 consultants that are being funded by the state, and the Colorado Children's Campaign finds that to serve the entire state, they could use 438 consultants. So that's a really big discrepancy between like the 34 that we have and the 438 that would actually serve all of Colorado. So this bill just really improves our system in Colorado and encourages the Department of Human Services to focus on improving the system through funding. They're discussing certifying mental health consultants. So it would really improve the workforce as well as the services that are being provided to children. I really want to leave this fact sheet that I have from the Colorado Children's Campaign. And again, just really encourage you to support this bill, because it's really important for children, families, and the prosperity of Colorado, and that we can provide childcare that really meets the needs of these kids in our state. So again, vote in favor of House Bill 1006. And here's my card. If you have any other questions, please let me know. I'd be happy to answer those. And I really appreciate you taking the time today to talk to me. Thank you. So there were some issues on the conciseness that was a little on the long side. depending on where and when you're trying to meet with the legislator. If you're pulling them off the floor, you probably want to be really concise, because that's when they're kind of wanting to get back to whatever's going on there. Sometimes if you're able to set up like a specific meeting with a legislator, you have the opportunity to maybe take a little more time with them. With the personal and personalized piece of it, you know, knowing that the representative has kids that are in that, you know, lower age group, like really might speak to him about like, what are my kids getting? Are they even getting the mental health services they need? Having some facts. These don't have to be facts that you have to spend a lot of time digging up. There are places like CBHC or the Colorado Children's Campaign, if you're focusing on early childhood like I do, that they come up with those facts already for you. And so you can really utilize what they've produced and then add sort of your flair to it to help bring people along. Again, because he's a member of a committee that would hear this bill, and that he already has an interest in early childhood, that really connects him to those focus areas. I clearly stated what my position was and who I was there representing, and asked a couple different times for him to support this specific bill so that he knew really where I was coming from and what my ask was of him.
Yeah, I think that's, I'm glad you ended on that, Katie. It's really important to be as clear as possible about the action that you're expecting the legislator to take. I mean, that's their job by the nature of the business, is to take votes. And so it's never, you know, we're sort of a little shy in asking, I think, in the general public sometimes, or those of us from the Midwest are anyway. But to go in there and to ask for them to vote yes or vote no on a bill and be very clear about what it is you're asking for in terms of their action on the floor or in a committee hearing is something I think that can't stress enough.
Absolutely. And I think sometimes too, this might be the first time that a legislator is even hearing about the bill.
Right.
So for them even to have a little bit of information going into the committee is really beneficial for them, because they kind of know what's coming, and once they're hearing testimony in that committee meeting, they know what to expect, and maybe some of the arguments for or against that bill that can help them formulate their decision and what their vote will actually be.
Yeah, in terms of the conciseness, I think, you know, one of the things that I was thinking about, and this is probably, you know, for the you know, thinking about having established you know, whether or not you have an established relationship already, I think will lead to some conciseness. But I think Katie did a great job in the example to connect herself to the Mental Health Center of Denver, so that if she doesn't have, and if you go in and you just have, you know, maybe 90 seconds or 2 minutes to make your case, but you're connecting them to a known entity like the Mental Health Center of Denver, so that when you use those initials or the term of your organization, they're connecting you. You know, maybe it's Jeannie Ritter on an issue, or maybe it's you know, Michael Nyampong on an issue. But when you make those connections for them, if you don't have an established relationship, that your organization already has some credibility and as a known entity for the Denver delegation.
And legislators know these people. They kind of know Frank. They know these lobbyists that really focus on some of these issues. So they know who they can go back to if maybe they want something a little bit more that you were unable to provide them as kind of a mental health provider, or somebody that's there to talk to your legislator or your council person. So they
Yeah.
do know these
Yeah,
people.
probably being a little too modest, but yeah, to use the CBHC, name and logo as well, because, from it's not just, the small organization of us, it's the fact that CBHC represents a statewide system of behavioral health providers that carries a lot of weight with the legislator, and especially the caucus. I mean, the Mental Health Center of Denver certainly carries a ton of weight with the Denver delegation. But when you're talking, to the larger body, I think it's these statewide associations that carry a lot of influence. And it doesn't mean, influence is, there's a number of different types of influence. You can have, money or power, and what our power comes from our grassroots nature in the fact that we do represent communities from all over the state, represent behavioral health providers that touch each county and each community in the state. Moses, I saw you're going to add something.
Yeah, I just wanted to also note that that was such a great example because it could have been so easily modified into a more formal sort of hearing. If you were actually providing testimony, you could have pretty much used the same exact narrative, but just added a little bit more formalities. So I thought that was great. And I saw the comment around, wanting to be that organized and calm. And I would just really encourage folks to practice. If you have a message that you want to deliver and you want to deliver it, whether it's just one time or to a bunch of different policymakers, practice really is the key, and you'll get more comfortable with the material. Frank, also, I see we have Amy online. I was wondering if we wanted to maybe, Amy, call on you for a couple of minutes to talk about the ambassador program.
Yeah, so we have a couple things at Mental Health Center of Denver. One of them is the Chamber Ambassador Program. And so what that has done is connect employees within Mental Health Center of Denver with 7 chambers throughout the metro area. And that gives a really good opportunity to network and also connect with other organizations and other people in the community that might be like-minded and help you practice that elevator pitch, right? And so during meetings for the Chamber Ambassador Program, we do go over your 30-second elevator pitch, if you have 2 minutes with somebody, if you have 5 minutes with somebody. So those are going to be very different pitches, right? And so they're going to go from, a little more broad to narrow focused at the more time you have. And then just to wrap that up, we also have an all staff app that we rolled out maybe like a year and a half ago, called Ambassador. And what that does is it's updated with all of our information for the organization. So that way, if you're out and somebody asks you a question like, how many people did you serve last year? Or what's the address for your walk-in center or anything like that? All of that information is on the app, on the employee app. And that way, everybody can be an ambassador when they're out and have that same information and be able to relay that. So to the point of having, their thoughts clear and concise and ready to go. A lot of times you are thrown questions you might not know the answers to. And so hopefully that will help.
And something that I had to learn is that you don't have to have all of the answers. You can always just respond and say, I don't have the answer to that right now, but here is the contact information for CBHC. They've really been working on this. They have the answer. Or our policy person is Stephanie. She can really help you understand this maybe from a higher level as far as the organization, or I'll get back to you on that, because it's better to have correct information than to just talk off of the top of your head and provide something that maybe is not in line with what's actually going on. And legislators are used to hearing that.
And it gives you an opportunity to follow up. And that's another thing we can't stress enough in terms of maintaining that relationship, to follow up, even if it's for a quick thank you. However you can contact that legislator, but if it's a text, an email, offer a courtesy thank you, but also, again, they answer any questions that were left unanswered during the initial meeting. I think that's our time for today. We've really enjoyed putting together the series on our side, and hope you've gained a lot of information from it and some benefit. And we look forward to seeing you all at the Capitol as you're making your pitches. The previous screen there, January 14th is when our community organizing discussion will happen. Again, it'll be 11:30 to noon time, and so we look forward to seeing you in 2021.
Thank you, everybody. Happy holidays.
Thanks for joining
holidays,
us, everyone.